Doctors are not gods. Doctors will do something that comes out of their intelligence, their intellect. I would not like to say that the society is intolerant, but society wants quick results. So there is a expectation mismatch from the person who is seeking service, doctor who is giving the service.
What can a doctor do to make sure that they treat the patient to the best of their ability and also safeguard themselves?
I have a certain manner in which I treat a patient in a certain way. So ultimately the patient has to decide where his trust lies. You get yourself a professional indemnity because you never know when it will hit you. And you're doing a profession. You are registered by the councils and the patients are seeking your service. Things can go wrong. Remember one thing, that risk can come from anything, or it can come from any step. From the time you receive the patient, risk can be there. From the time you discharge. Just imagine I, being a doctor, will not be medically covered if something goes wrong.
Hello and welcome to the very first episode, the pilot of Policybazaar for Business presents the White Coat Tape. शुरू यहाँ से करते हैं कि हमने इस पॉडकास्ट के बारे में सोचा क्यों। पॉलिसी बाजार फॉर बिजनेस में हम हजारों डॉक्टर से जुड़े हैं, बेस्ट ऑफ डॉक्टर्स इन इंडिया जिनके साथ हम जुड़े हैं। एंड ओवर टाइम वी रियलाइज्ड, हम लोग बात करते हैं कि पेशेंट की ट्रीटमेंट कैसे इवॉल्व हो रही है, हम लोग काफी बात करते हैं कि क्या बेटर हो सकता है फॉर पेशेंट सेटिस्फैक्शन, बट हाउ मेनी ऑफ अस टॉक अबाउट द काइंड ऑफ रिस्क दैट डॉक्टर्स आर डीलिंग विद टुडे? The rising cases of litigation, the mental, emotional, physical pressure on doctors. We're not talking about it. And this is a podcast dedicated to all the wonderful doctors in India because we want to talk about you and we want to talk to you. As our very first guest for this particular podcast, we have Dr. Kapil Gandhi. Welcome to the show, Doctor.
Thank you so much. Thank you, Umang, for having me over.
Thank you so much for making time to be on this podcast, sir. Dr. Gandhi has over 25 years of experience. He is an expert in dentistry. He's a pediatric dentist, so he's an expert at dealing with kids, toddlers, while relieving them of dental pain. And he's done an MBA. So my first question to you is very simple. According to you, has the definition of being a good doctor changed?
See, all doctors, I assume, are good doctors only because they've chosen this profession to begin with. But since it is a very subjective description of what you expect out of your doctor, basically, a good doctor is something that probably is coming out of your reference, first thing. A good doctor is somebody who is giving you good outcome of your problems. A good doctor is probably who is listening to you. So today's one big problem is that doctors don't listen. And every patient who's been preparing his file and going to meet a doctor is probably left out a little short कि डॉक्टर ने अच्छे से सुना नहीं, उसने 5 मिनट सुना और उसने he just gave a prescription and this thing. So probably for that patient, the definition of a good doctor would be somebody who is listening to you and who is trying to be empathetic, who tries to understand you.
Very well answered, Doctor. And in today's day and age, how real is the fear of litigation? मतलब एक टाइम था जब हम सिर्फ इंटरनेशनली सुनते थे कि डॉक्टर को सू कर दिया क्योंकि यहाँ पे डॉक्टर पे केस कर दिया क्योंकि पेशेंट को लगा कि अच्छे से नहीं हैंडल हुआ या बाद में कोई प्रॉब्लम हो गया. बट इन इंडिया, डू यू थिंक दिस फियर इज बिकमिंग रियल?
Yes, of course. पहले था कि society was a little more tolerant. Now, I would not like to say that the society is intolerant, but society wants quick results. Society wants precise results. Society wants best results out of cheapest money that goes out of their pocket. So there is always a expectation mismatch. And society of all the things is now people are reading online and then trying to make their own mind and trying to learn about the disease and then approach a doctor and adding on to the pressure to the doctor. So there is a expectation mismatch from the person who is seeking service and doctor who is giving the service. And doctors are not gods. Doctors will do something that comes out of their intelligence, their intellect, and then what they can do from your hand. So in either of the three ways, they're not gods and they're not the best. Neither any doctor claims that he's the best. So it is a patient who has chosen to choose this particular doctor, come to him, and then seek his services. So that is where there is a little expectation mismatch.
अगर कोई सेकंड ओपिनियन ले रहा है आपसे बात करने के बाद, या अगर किसी और डॉक्टर से बात करने के बाद कोई आपसे सेकंड ओपिनियन ले रहा है, उसके क्या लीगल रैमिफिकेशंस हो सकते हैं, एंड व्हाट कैन अ डॉक्टर डू टू मेक श्योर दैट दिस ट्रीट द पेशेंट टू द बेस्ट ऑफ देयर एबिलिटी एंड आल्सो सेफगार्ड देमसेल्व्स इन केस ऑफ such a second opinion or anything controversial to do with another doctor.
So as far as an opinion goes, there is not much of a conflict that goes. So I can have an opinion and any other doctor can have a different opinion. Any third doctor can have a third independent opinion or can tell the first two either one of them is correct or not. So, but I am entitled to my opinion. So anything going wrong at this level is not against me. For example, I come out of a 25 years of practice. I come out of many years of teaching. I come out of many publications and everything. So I have a certain manner in which I treat a patient in a certain way. That could be different or not liked or not approved by another doctor. So as far as opinion goes, there could be varied opinions. So ultimately the patient has to decide where his trust lies, where his faith is, where he will get healed. Getting treated is different from where he's getting healed.
Sir, how important is documentation and how do you go about it? Consent लेना, हर चीज को document करना, because it's not always easy to take a consent. What if the patient is in a lot of pain?
As soon as the patient comes in, you have to inform the patient what is the problem. So consenting is a very critical part of it. That is one part of it. So documentation is what you are doing as a procedure. What I have seen and what I have trained during my training days is that you document any work in a past tense. So for example, somebody has come and some procedure has to be done. Since I'm from a dentistry background, you want to do a root canal and crown. So you have given choices of this is the root canal, this is the cost of the treatment. The cost has to be very integral part of it. Your information that you're imparting to the patient. Then how many steps it will take, what are the chances of success. So you're given everything and you inform the patient. Thereby you record an informed consent. So patient has consented to do this thing, and in the consent it is very clearly written that outcomes are not warranted, not guaranteed. We are not gods, we cannot do that. Things can go wrong, and if they go wrong, we will inform you.
A lot of cautionary tales about why you need insurance.
If you have an award against you through some litigation, then of course it will affect your reputation as well as your finance. So of course reputation is something that you have to safeguard, but at the same time you have a certain financial impact that can derail your entire financial management. So I really don't know whether a lot of doctors have their indemnity insurance, which will not be guarding them against a fame loss, but will of course be able to take care of the financial hit if there is anything. As far as youngster goes, they don't know, they don't feel that there is an importance, but the rules and the laws are such that if you are treating anybody either on behalf of a doctor or on behalf of the clinic where you're working or in an independent capacity, if you're treating any other human being who is in this country who's part of the society, then there can certain things that can go wrong. If you're doing something out of emergency, that is spared. But if you're doing something out of as an elective procedure against a commercial arrangement, then things can go wrong. And if things go wrong, then there of course is a probability of a litigation. And if litigation is awarded against you, then how will you handle yourself? So it's always better to have an indemnity kind of a arrangement where if something goes wrong, fame you will lose, because the society is such that they like to glorify things. But genuinely, I have seen over the past that if you have done everything correct and you have been honest to the patient, things will not go bad.
सर, आप कोई रियल लाइफ एग्जांपल दे सकते हो जहां आपने किसी सीनियर या यंग डॉक्टर के साथ कोई भी लिटिगेशन का केस देखा है? हाउ डिड दे डील विद इट?
I have two experiences of past, because I was working as a head of dental center, and we had a setup. I'll not take the name of the institutions or the doctors. So there was a litigation. So there was a certain litigation about things getting damaged in the mouth, and there was a trauma. The patient went and filed a consumer in the court. Luckily, we had all the documents, and the doctor who was my junior and was working under me, I was not in the center then, did everything that was supposed to be done. Now, the litigation had two components. One is to establish whether there was an error and willful error or negligence. So once that was established, it was only required for me to go and write an affidavit in the court that such errors can happen. And so the case was dismissed. The second episode, where I was again a junior member, where a doctor was performing and there was some procedure that went wrong. So the patient went to another doctor. And now over here, because it's a demographic competition between the two doctors, so the writing and the notings that were made by another doctor were clearly descriptive in a manner that implied that this doctor is wrong. So we had to defend that also.
Oh, okay. How does that work?
See, the simple thing is that what had gone wrong is a part of a routine thing that can go wrong. Even if you're doing a cardiac or a neurosurgery, things can go wrong. And things do go wrong. There are things like fatalities that happen. And fatality is a part of an outcome of any procedure. In this particular case, something not to that extent had happened, but some instrument breakages and something like happened. So again, we had to highlight that this is part of the normal procedure, which can happen during a procedure. Whether we have informed to the patient, yes or no, that is something that is going to be assessed first. It is naturally something can go wrong. So it was dismissed on that. When I was doing my insurance till a while back, I was taking it from a nationalized insurance. Right, so professional indemnity. So how it worked was, God forbid, if there was any litigation and award against me through a court, then I would have had to go to my insurer and say कि मेरे को इतना compensation हुआ है award, so please do it. So they would have given the check to the party, right? But in all this case, legally I would have had to handle it myself. As far as youngsters goes, the main thing is, I believe that if you go and involve yourself in a litigation, for a senior doctor, your time goes, you have to attend the courts, and you have to pay the lawyers and advocates fee. That is also a substantial amount. So better would be to take a team of an expert which takes care of your litigation as well as the compensation if anything is awarded against you. And they can guide you, they can handhold you. And generally, if something goes wrong like that, you have a tendency to fog out. You don't know what is correct. You reach out to your friends, you reach out to people, you reach out to your friend advocate or something like that. So if there is a one-point solution, something kind of relationship manager kind of a thing that you call up that this thing has gone wrong and the person is at your clinic in 1 hour or the team is in your clinic by half of a day, then that kind of, big mental kind of a support that comes to any doctor that is practicing. If you work in an IPD setup, in a hospital setup, where you're doing general anesthesias, you're doing other procedures, then of course you need a bigger insurance. It's not how much insurance is there, but how many times your insurance supports you in a year. Second thing is, I should have the advocates and the legal cover. Third, it should be multiple accidents. Fourth, it should permit me to work into any medical setup. Now, the circumstances are teaching you how to advance your practice. If you are a very busy doctor, and you are working in a hospital and you have a big line of OPD sitting outside this thing, there will be a tendency to get a little snobbish. See how the logic works. Logic is that you do your degree, you are licensed, and then you can treat the patients of this country. And the patients seek your service, and then something goes wrong, then besides the emotional part, the emotional damage that will happen to you, there could be a monetary damage, which is awarded from the court. So indemnity takes care of that part. You have to self-take care of the emotional part. If the doctor who is senior, who runs the show, they don't handhold the junior doctor, then the junior doctor is on his own. Right? So a good philosophy or good policy would be that even if you're going and working in a bigger setup, you get yourself a professional indemnity. Because you never know when it will hit you. And you're doing a profession. You're doing a licensed profession. You are registered by the councils. You are allowed to touch the patients. And the patients are seeking your service. Things can go wrong.
So what about post-operative situations? Like you've operated on someone, the treatment is done, and then they come back, but they're not completely relieved. They have some issues. What kind of risk can come up in that situation? And how do you manage it?
There can be two risks, right? Risk can come from any step of the entire process that I've been mentioning about. It can come from any step. From the time you receive the patient, risk can be there. from the time you discharge. And of course, in a follow-up, there is something. So it's always a good policy. In my clinics, what we do is we follow up with the patients who are troubled and severe pain. We try to take the symptoms if everything is good. And we also leave a message that we are sharing the number of the chief doctor with you. So if you have any problem, you connect directly. So the risk can come. This, of course, contributes towards the goodwill. As far as the risk goes, risk can come at any step, from the patient even not able to telling you that the patient is hypertensive, or there was a patient is on steroids, the patient is pregnant. So what do? So you have a form, medical history form. The patient has to choose whether the patient is having diabetes or HIV or hypertension. Do they choose? So risk can come from taking a medical history also, and documentation also. So risk can come from any step.
So what should a doctor keep in mind, God forbid, if anybody ever has to face litigation? What are the things that will go in their favor?
First thing first, when the patient comes, you take a good medical history and you document the chief complaint and you write your diagnosis or differential diagnosis very clearly. So once you have that preset procedures, then the patient would sign on it. So the buck stops there. If your documentation is in order, then 90% of the times you are not going to get affected.
Does it ever happen that in the middle of a work week or a work day, you think to yourself that I need a break? And then how do you prioritize your family time, your personal time, your mental health? What is your way of doing that?
See, as family grows around it, family grows in an ecosystem. I come from a joint family where I know my daughters are with my wife is also a dentist. She also works. She's got a lean period, but her practice is very close to her home. So she's at home. Essentially, kids are taken care of. But you plan things. For example, you always feel like taking a break. Especially what I did was, after COVID, I decided that 10% time belongs to me. So 10% is equal to 3 days in 30 days month. That refreshes and charges me. And then chasing my hobbies, basically. Some people want to earn a lot of money. Some people like to balance it. So probably I'm somewhere in the middle.
Thank you so much for being on this podcast, sir. I am very sure that it has been helpful to all the doctors and the society that have been listening to our podcast. The relatability, the honesty with which you've explained everything. Thank you so much. I can only imagine what your patients feel.
Thank you for having me over and giving me this opportunity, first and foremost. It's also a privilege that I'm the first doctor whom you're talking to for this podcast. And hopefully I have got a little, a food for thought, at least for the young doctors and the practicing doctors who would probably till now would be marginalizing the need for a professional indemnity.
We hope that this has been helpful for you, and we are sure that you will stay tuned for our upcoming episodes where we'll be talking to many doctors like Dr. Kapil Gandhi.